Walking is the most common form of physical activity in adults in the U.S. And we've discussed in many videos that doing physical activity, exercise, is very important for maintaining health, preventing chronic conditions, and improving longevity. According to an interesting survey, about 50% of households in America have a dog. From an exercise perspective, taking your dog for a walk is a great way to meet your exercise requirements for the week. And physical activity guidelines say we should get 150 minutes per week of physical activity. So if you just walk your dog 5 days a week for a half hour, right there you get your 150 minutes. But it's important to be careful when walking your dog to avoid an injury from either being pulled by the leash or tripping over the leash. In this video, I'll review some of the common orthopedic injuries that occur from walking the dog and some suggestions on how to avoid injury. Hi, I'm Dr. Edmond Cleeman. I'm an orthopedic surgeon here in New York. I specialize in sports medicine and arthroscopic surgery. There was a recent study that was published this year that was an analysis of emergency room visits by adults because of a dog walking injury. And the annual incidence has increased more than fourfold during this period, from about 7,000 a year to about 30,000 a year. The mechanism of injury, most injuries, over 50%, are associated with the person falling, whereas about 45% of injuries were involved because the patient was pulled by the leash but didn't fall. So you can imagine their arm got pulled. So to break it down a little bit more, so those who were pulled by the leash but didn't fall was about 45%. If they were pulled by the leash and did fall, that was about 24%. And those who got tripped by their leash and fell, that was about 20%. Or those who got tangled up in a leash and fell, that was about 11%. Now, the three most common injury types were fracture, means a broken bone, and that occurred in about 28% of those ER visits. Having a sprain or a strain or a muscle tear occurred in about 25%. And a contusion or abrasion, like a scrape, occurred in about 15%. As you can imagine, the area of the body that was most commonly injured was the upper extremity. And here, finger fractures, shoulder strains or sprains, or wrist injuries were the most common. Now, compared to younger people, older adults, those over 65, who may already have some balance issues, have over a 3-time higher risk of falling when walking a dog compared to someone who is younger. And they have a 2-fold increased risk of breaking a bone. Some recommendations on how to avoid injury. Number 1, holding the leash in the palm of the hand, not wrapped around the finger or wrist. That can be very helpful to avoid injury. Number 2, using a shorter leash will make it less likely that you get tangled up by one. Number 3, for older adults over 65 who may have balance issues, maybe doing a resistance training program or balance exercises are important to help prevent the fall. And then finally, number 4, try not to get distracted while walking. Try not to be looking at your cell phone or texting while walking. That will also help prevent injury. Thanks for watching this video. Hope you found it helpful. If you did, please click the like button below and subscribe. I look forward to seeing you in my next video or in my office.